But here's something that is perhaps even more worrying. Hundreds of scientists now saying that there is evidence that novel coronavirus could be airborne, and smaller particles in the air can infect people. They're in fact calling for the WHO to revise their recommendations. The WHO has said that the disease spreads primarily from person to person through small droplets from the nose or mouth that are expelled when a person with COVID-19 either coughs or sneezes or speaks. Well, in an open letter to the WHO, the researchers say they plan to publish in a scientific journal their findings. They are outlining evidence showing smaller particles can, in fact, infect people. The WHO has so far not reacted to this. All right, we're being joined by medical experts this morning to take us further in this discussion, what this is going to mean in terms of India's fight against coronavirus, as well as we're seeing an increasing number of cases. Dr. Wali, senior physician with Gangaram Hospital and former physician to the President of India, is with us this morning. Dr. Wali, how seriously do you take this claim that Reuters and other international agencies are now reporting that as many as 239 scientists are now saying that coronavirus could be airborne? And what could this mean if this is indeed correct?
Well, yes, it could mean a seriousness is increasing day by day. And as we are seeing the numbers are rising, we just stepped up by one mark. We just said that we are number 3 now. So this is all indications that coronavirus can be infecting more people through an unknown route by air, open transmission by air, and the presence of the coronavirus, which they have claimed to be in the air, is more disastrous. And therefore, it means to people, more importantly, that they should not come out. 1, 2, they should wear the mask very, very strictly. Even I would say I'm wearing it at home also. And I'm instructing my children to wear at home as well, and strictly not to go out. This is what it means to me, and it means that the spread can be more and more every day. And as we are seeing the rising number of cases, this is evident. This is evident. So,
Right. Dr. Rajesh Parekh, Director, Medical Research of Jaslok Hospital, who's also the author of the book Coronavirus, What You Need to Know About the Global Pandemic, is also with us. Dr. Parekh, thanks for speaking with NDTV. Now, my question to you, of course, is, now that we're looking at India really surging ahead in terms of the number of cases, we've just gone past yet another very grim milestone, having gone past Russia. We're now the 3rd worst affected country in the world. And when you look at the rate of change, it's not going to be long until we overtake certainly number 2, which is Brazil, and perhaps even come close to the United States, which is far and away the world's worst affected country. Would you say that easing of lockdown restrictions has been a problem? Are we looking at a potential scenario where more and more places could go under lockdown again? We're already seeing city-specific lockdowns, for instance, in Thiruvananthapuram today, going into total lockdown for a week. Is this going to be the way forward?
Possibly. First of all, the experience across the world is whenever lockdowns are lifted, and along with that, if there is a surge in the increase in tests, one inevitably sees more and more confirmed cases. This doesn't mean that the cases were not there to begin with and suddenly came out of the blue. It's just that the testing gets ramped up and the non-confirmed cases subsequently become confirmed cases. In terms of will there be lockdowns in future, I think we have to be absolutely flexible. One shouldn't just look at the optics of it all and do whatever is necessary to keep the infection rates and, of course, the death rates down. But if you have a minute, I do have something to say about the airborne part of it.
Yes, certainly. Go ahead.
Thank you, Akita. 239 scientists...
And if we can get that graphic up on our screens also. Yes. Go ahead.
Sure. So 239 scientists, of course, have written to the WHO. We wrote about this in our book, the book that you mentioned, as early as March. And in the book, in one of the opening chapters, we have written that the distinction between droplet-borne and airborne is very hazy and ambiguous.
Right.
And for that, we quoted a somewhat complex equation called the Wells evaporation curve. And in a nutshell, what the Wells evaporation curve says is that as the droplet containing the virus falls to the ground, depending on the humidity and the wind velocity, it evaporates, becomes lighter even before it hits the ground. And when it's light enough, it can be airborne. So we talked about airborne dissemination as early as March. And I think it's about time the WHO came to terms with it and accepted, because otherwise it lulls people into a false sense of security, which is always dangerous.
Now, Dr. Parikh, when you say that, and other scientists are also now asking the WHO to revise its recommendations given these findings, which they say they can now prove, the WHO hasn't actually formally responded to this beyond saying that they feel that the guidelines perhaps don't need to be revised. But what could these new guidelines be?
Well, the new guidelines would be that do not ease out on your safety measures, particularly when you're in closed spaces, such as elevators. About 2 months ago, when everybody was talking about Dharavi in Mumbai and how bad the situation was, and I told that those of us who live in high rises shouldn't feel so secure, because high rises at the end of the day are vertical Dharavis when it comes to the number of people using a common space. So the lesson for all of us is not to feel secure because the apartments are large and we have no space around us, or we live in affluent neighborhoods, to keep in mind that this virus does not discriminate between the rich and the poor. And we have to be careful, because if it is airborne, as it indeed seems to be, then one could contract it even within one's house or within one. So generally wear a mask as often as possible.
Right.
All right. And maintain social distance, of course.
All right. Dr. Venkatraman, is that an assessment that you would largely agree with, as we talk about, over 200 scientists now writing to the WHO and saying that they're going to publish their findings that coronavirus could well be airborne? Will that sort of change our understanding of the disease and how to tackle it?
Yeah, absolutely. I am really, really grateful to Dr. Parikh for having absolutely clarified that particular point. And because we are having patients who walk in and say that I was by and large inside the house, and how did I pick it up, and how did my parents who have never stepped out of the house are becoming positive. And the more the geriatric the population, the more is the sickness and more ICU requirement, and we are literally battling that out here. Also, the fact that the paranoia about not opening their doors, the windows. Ventilation is a very big problem in Chennai because our humidity is very, very high. People want to stay inside the house with AC on, in spite of government recommendation to keep the AC off during the day or at a certain degree, because it is so hot and humid. The humidity itself is increasing the Wells phenomena, which Dr. Parikh was talking about, and our cases are just ramping up like it's just like one scaling up, right?
Yeah. Would you say that, Chennai is, of course, seen a series of smaller lockdowns already. Now we have Thiruvananthapuram from today going into a 1-week triple lockdown, as it's being called. So a 3-tier lockdown, which is looking at the full city limits, but also stricter lockdowns within containment zones and other areas. So do you see that as the way forward for South India, which is now contributing perhaps the most to India's overall number of cases?
I think by now, lockdown in Tamil Nadu, especially in Chennai, is redundant. We are not really going to be achieving anything major by lockdown, because if Sunday is a lockdown, Saturday is the next Sunday, or Monday is going to be the next Sunday.
Right.
So we are really not going to be achieving anything major, except probably giving the doctors a little bit of relief on Sunday. That's about it. Right. I don't really think we are doing any major by doing a big lockdown on Sunday. It's not. I think we are past the stage for Sunday. We just have to ride the peak. Absolutely. I mean, we're really waiting for the day where we will just...
serious words there indeed. But thank you all for joining us on this program this morning.